Hi, I'm Ashley Lonkin, and I'm with Dakota College of Botano, and I'm going to initiate blood transfusion therapy. So first, I'm going to make sure that there's an informed consent signed before initiating any type of blood transfusion or any education provided. I'm going to make sure that the patient agrees to the blood transfusion. So I'm going to look in his chart, and I'm going to make sure that the informed consent is consigned. So, and I have the patient's orders and physician orders in the blood bank product stuff information here. So after making sure that there's an informed consent sign, I'm going to go into the patient's room and I'm going to establish a baseline set of vital signs. I'm going to educate the patient on signs and symptoms to immediately report, such as like flank pain, a sudden headache, chills, anything like that, any out of the ordinary symptoms to please report, even if he doesn't think that they are concerning, just need to report it. So making sure that my patient understands and making sure that all questions are answered, and notify the physician if questions are unresolved, to make sure that the physician comes in here, or the provider comes in here, and making sure that the patient understands what is needed of him, and make sure that he has all his questions answered. So after doing all that, I will check my physician orders, and I see that he has type and cross-match 2 units of packed red blood cells, transfusion when available. So after looking at my orders, I'm going to go to the blood bank and I'm going to get my blood. Okay, so I have my blood here. Myself and the lab tech will check out the blood and making sure that everything matches up with the blood and the paperwork and the patient. So the units and everything will match up with the information provided on the blood bank identifier. So we just make sure that the wristband number is fine, the what type of blood it is, the unit number. The unit number of the blood is matched up, just making sure everything is make sure everything matches up very precisely. So once the lab tech and I check it out, I will obtain another RN to help me, or to assist me into double checking the blood. So once I get my other RN, we're going to go into the patient's room and we're going to first check the patient identifier. So I'm going to have my RN assisting me look at his patient identifier wristband, and I'm going to say the patient, the name, the date of birth, and he's going to confirm it, and the patient can also verbally confirm that the name and date of birth are correct. Okay, so once I do that, I can I will look at the blood band that the patient is supplied with. So the patient's blood band is going to be, this is leaking everywhere. Patient's blood band is going to match up also with what is on the client. The patient's blood band will match up what's on the blood card, or the blood bag. So I'm going to read the patient's blood band number, the medical record number, the type of blood that we are initiating, and the patient's cross match blood. And the nurse that is assisting me is going to confirm that is correct. Okay, so I'm going to set this over here because it's leaking everywhere. So once I make sure that the blood is correct with another nurse, we are both going to sign off that is the correct blood, this is the correct patient, everything is perfect and ready to go. So once I do all that, I'm going to make sure that I'm going to, perform my hand hygiene, get my gear on if I need it, and I'm going to don gloves. So I'm going to don my gloves, and I'm going to make sure that the IV line is patent. So I'm going to get a fresh flush, and I'm going to wipe that hub for 20 to 30 seconds, like so. I'm going to make sure that there's all the air out of the flush, and I'm going to hook it up and flush the line with 3 ml or 5 ml or whatever per order. Just make sure that it's patent. So once that line is patent, I'm good to go. So I can start initiating my blood transfusion therapy. So, and once again, you need to get baseline vitals before you initiate any type of therapy, and you need to have an informed consent. So now that I have all that ready to go, I'm gonna take out my blood, and I'm gonna make sure I have my supplies before I go get my blood from the blood bank. So I'm gonna make sure I have a blood tubing. I'm gonna make sure I have normal saline, because that's the only thing you can administer blood with is normal saline. And then I'm going to make sure that I have flushes available. Okay, so I have my blood transfusion kit here. I don't like this one. Okay, so I'm going to make sure my roller clamp is in the off position. And I'm going to make sure one of these, one side of the spike is, excuse me, I'm sorry, is clamped, okay? So I'm going to clamp one over here, okay? So I'm just going to get rid of all this extra nonsense. So I have my spike here. I can just hang this stuff up for now. Okay. And I want to make sure that you keep this clean. So I got my normal saline. I'm just going to pull out the thing, and then I'm going to take my spike head off. And without contaminating it, I'm going to spike this crazy hard bag to spike. Okay, so actually you want to make sure this is clamped off too, but I don't think that's a big deal. But anyway, so I have my bag spiked. So I'm going to start priming my line. So just like every other line that you prime, you want to make sure that that there's no bubbles in it. So you want to fill up this filter all the way to the top with normal saline. And just keep squeezing it. Okay, so that's filled to the top. Then you're gonna prime your line, making sure, like I just said, making sure there's no. I'm just gonna open this little guy just a little bit. Seems like that's the best. Yeah, that looks good. Okay. once your line is primed, okay, so once your line is primed, you can shut your roller clamp all the way off. And then you can clean off your hub again. And my guy here, sorry, clean off my hub again for my guy. And just hook up my line. Okay, so my roller clamp is off. I have no bubbles in there. I'm ready to go. Okay, so I'm ready to initiate my blood therapy. So you're going to spike this the same way, and then you're going to clamp your normal saline. You're going to clamp this guy here. Okay, so now I clamped him. I'm going to spike my blood. Okay, so my blood is spiked. Right, so I'm going to open it up. I'm going to open my roller clamp up slowly. I'm going to set the rate at a slower rate for the first hour. Okay. So my rate is set, and then I'm going to stay with my patient for 15 minutes. For the first 15 minutes, I'm going to establish another set of vital signs. I'm going to assess for any type of signs and symptoms. I'm going to make sure that he's not shivering or having like that flank pain, or like I said before. Or, you know, some hospitals or some other policies and procedures are different. So just make sure that I follow that when I administer blood product. So I stayed with my patient for the first 15 minutes, and after that first 15 minutes, I grabbed another set of vitals to make sure that, you know, they're not fluctuating a crazy amount. I need to, if I notice any type of transfusion reactions, I need to stop that transfusion. I need to disconnect it from the tube and make sure the line is patent. And the blood bank is going to mount the tubing and the blood, the whole thing, so we cannot discard of it if there's a transfusion reaction. So just make sure that we keep that for them. So and then you don't want the blood to hang more than 4 hours. So just making sure that finishes up. They usually like it within about 2 hours. So after this transfusion is all done and everything is good, I'm going to go in and per orders, these orders here, I'm going to administer 40 milligrams of IV push Lasix after the first unit of packed red blood cells. So I'm just going to disconnect him, and I'm going to get my 40 milligrams of IV Lasix. And you're just going to do the same thing. You're going to disconnect him, you're going to flush it, and you're going to give the medications of 40 milligrams and make sure that all your patient identifiers are correct and doing everything that you're supposed to do with medication administration. So I'm going to give my Lasix, and then I'm going to flush him again, and then I can hook up the second unit of blood if everything is okay. So once I hook up the second unit of blood, you're going to do everything like you did for the first unit. You're going to establish baseline vital signs. You're going to make sure the IV is patent with the flush, and then you're going to make sure you get a second nurse to check out all the information with you as you did the first unit of blood. Every unit of blood is different, so you want to make sure that matches up with everything. And then, like the second unit, just like the first unit, you're gonna stay with the patient for 15 minutes. You're gonna monitor vital signs per policy or at the end of that 15 minutes. And then you're gonna make sure that you grab a set at the end of the transfusion. As with the first unit, you need to grab a set of vital signs at the end of the transfusion. And then you're just gonna after the second is done, you're just gonna disconnect him and you're gonna flush him like so, and then you're going to document everything in the record. And if no transfusion reactions occur, everything should be fine and everything should be documented. But like I said, if transfusion actions occur, you need to make sure that you notify the provider and keep the tubing and the blood transfusion. And then with the second unit, you're gonna get a new tubing. You're gonna get new saline. You're gonna get everything new like it was the first unit. And then with blood, you want to make sure that you are giving 500 to 1,000 units of a normal saline after the infusion. So you just prime the line with the saline, and then after the blood, you're going to give the saline per provider order, maybe bolus, maybe set at a rate. It just depends what's on the order for the provider. So, and then, but typically between 500 and 1,000 units, or 250 and 500 mLs of normal saline is what's the protocol for blood, so you can flush it all through the body. And I think that covers everything. Thanks.